Hello friends, lever action is very famous and important principles of physics, and it is used in many things that make our life easier. And in fracture surgeries also we apply the principle of lever action very often to achieve good results out of surgery. Archimedes, a famous physician, once told that if you give me a place to stand on outside the earth and a stick long enough, and I can move the world. So this is the power of lever action. Friends, I will give you an example. If you see two branches of this tree, they are outlined here and they are quite embracing each other. And if I place a tender stick and just give it a little push, and you can see how beautifully they are separated with less effort and without touching the actual branches. Similarly, you can see these two metal pipes, they are hugging each other. I can place a stick in between them and lever one out of the other. Similarly, these two metal blocks, they can resemble fracture. So I'm placing an artery forceps uh, underneath one of the block, and then I'm trying to push the blocks away, and slowly they the overriding is neutralized, and we can see they are well placed now. So similarly, these are very common fractures we see. They are called bayonet injuries, one segment overlying each other. So in these type of cases we use lever action very uh, efficiently. So friends, in this example I'm showing you a case of forearm fracture. Now you can see radius and ulnar fractures, and ulna is in bayonet apposition, is one, both bones are overriding each other. And we have now placed a nail inside the one of the bone, and now you can see that bayonet apposition is still there, the bones are overriding. So now we use the principle of lever action by placing a artery forceps with small incision into the fracture, and the forceps is advanced to feel the both bones and touch one of the bone, and in a slanting manner. Once the bone has been felt with the artery forceps, we can reverse its position, and so that one of the end is leveled out of the other in a very good alignment, and now the nail can be passed from one end to the other, thus reducing the fracture. So this is the lever principle. It is achieved through regular practice, but once you master it, it is a very good technique. In next example, we show lever action technique management in a case of supracondylar humerus fracture. It is a very common fracture, and the displacements are very similar to bayonet apposition. So we can use lever principle in these cases as well. So with a minimal invasive technique, we can pass any wire or blunt object or a forceps uh, posteriorly by making a stab incision first, and we can pass a artery forceps in between the fracture, feeling it, and placing the forceps in such a way that one fragment can be reduced, levered out, and reduced well, and then fixed with wires. In another example, we show a lever action principle in proximal humerus fracture. Now you can see a very displaced fracture of proximal humerus. We are placing a wire within the fracture, and then followed by a artery forceps, and then reducing it to a good alignment before fixing with K wires. So friends, you can see in many instances we can use lever action principle in fracture surgeries to our advantage, and help patients reduce fracture well, and hope for the best outcome. Thank you very much.